This video is going to cover the diseases of the urinary and reproductive system. So some of these, yeah, they're going to go, we're going to have to go there. So all of this, of course, is under the infectious diseases part 1. Down here is a review for the exam. Basically, you have to know like what causes these, what are some symptoms, what are some characteristics about each disease. So to start you off, it says here that, well, normally urine is acidic. Now we're going to do the urinary diseases first. Here are the kidneys. The left kidney is a little bit higher than the right one. These are ureters that come down to the bladder, and then this is the urethra, which would be the exit. And bladder infections are more common in females than males. The male urethra, the opening is away from skin, so there's less likely to come in contact with skin flora. But this is the entire urinary system. Now, like it says here, millions of girls and women, and guys can get them too, but the urinary UTIs each year. And it says systemic diseases can affect the urinary system. So there are things that can move into the kidneys as well. So a couple of terms here. Urethritis would be inflammation of the urethra. And I can show you that in the next section of this video, as far if you don't know what the urethra it's not just a great idea. Urethra is the exit to the bladder. Now, cystitis means bladder infection, so cyst refers to bladder, and then you have also prostatitis, that happens with guys. Guys have a prostate. Urethra goes through the prostate in males, and I guess, look, I can just bounce ahead real quickly here. Let me go all the way down. So there's this is male, female reproductive system, but here's the prostate, and you can see the urethra in males. It's longer, it's away from skin, whereas in females the urethra is a lot shorter. So that's the only reason that males can get bladder infections as well. So disease, nonspecific urethritis. So the inflammation of the exit of the bladder, and most pain like that, burning kind of pain, non-gonococcal urethritis. Okay, so chlamydia trachomatis, catheters, direct contact, sexual contact, and chlamydia trachomatis is a bacteria infection. So you probably heard of chlamydia, but dysuria means painful urination, and since female is more susceptible, it has to do with the length of the urethra. But yeah, this is pretty common type of disease. Cystitis, it says Escherichia coli, and that's not the only, that's the major causative agent. I didn't list all of the possible organisms. There's so many. This is a major causative agent, E. coli. Cystitis is a bladder infection. And transmission ascending from the urethra or descending from a kidney infection or sexual contact. But it's one of those skin flora type things. Say males can get it as well, bladder infections. But dysuria, hypogastric pain, so hypogastric lower abdominal pain, frequent urination because the bladder gets irritated, and so there's always signals being sent to empty the bladder even when it's not full. Females are more prone to bladder infections because they have a shorter urethra than males, and the urethra is closer to skin and other body parts in females. So, all right, toxic shock syndrome, TSS, and I didn't show you any of these yet. So this is we have PowerPoints for these as well. There's the nonspecific urethritis, cystitis, which there's the bladder, there's the urethra. We already covered that. Okay, so toxic shock syndrome is a staph infection, and you may not hear about this much. It's not necessarily what I'm going to talk about, but it does occur sometimes with surgery because basically Staph aureus is on skin, and if you have gauze or something surgical that stays in contact with skin for long periods, staph will actually grow on that particular blood soaked areas. This picture was from back a long time ago that tampons were made to last a week at a time, super absorbent, and so those were causing toxic shock syndrome. because staph was growing in that area and its body temperature. And so there are all kinds of reasons. It says, postpartum infections, highly absorbent tampons, meaning people were leaving them in long periods. Can occur in newborns, children, and men as well. So fever, low blood pressure, shock, and a red rash. Now, this is pretty bad. The shock is a combination of heart rate decreasing along with vessels dilating. It's almost like fainting in a way. Of course, person can die of shock. There's all kinds of different shock, and there are times where somebody needs blood transfusions and stuff for that kind of thing. So, all right, so that was pretty quick. So those are they're called UTIs, so urinary tract infection type of things. Bacterial disease of the reproductive system, most of these people have heard of. An STD, sexually transmitted disease, not necessarily always, but here are male parts. Here's the bladder. This is an area called the vas deferens, a little cord that's cut during a vasectomy. Here are the testes. Here's the penis. These are 2 layers of erectile tissue. And there is the urethra. And then it goes all the way up. Here's the prostate gland. You can see it there. This is called the ejaculatory duct, which is how sperm get around into the urethra. And this is called the seminal vesicle. But yeah, the urethra in men goes right through the prostate. Females, here is the uterus. Here's the ovary. These are the oviducts or fallopian tubes. That's the ovarian ligament. Here's the bladder. This is the external genitalia, but there's the urethra. Here's the vagina. The vagina leads up to an area called the cervix, which is the opening of the uterus. Uterus is where a fetus develops. So it's a real quick introduction to all the reproductive parts, but just think of the urethritis. That's what's irritated, say males and females. But gonorrhea. Gonorrhea actually has a street name called the clap, and it's called that because it causes pus formation. And males usually have all the symptoms. Females can too. But gonorrhea, the bacteria have fimbriae, and they stick on the inside of the urethra, which then causes an infection, and then the body sends white blood cells there to fight the infection. And that's what the major symptom of gonorrhea is, pus. But burning, painful urination, supposedly extremely painful, is not something that you wonder about. It's something that usually causes medical person to go to the doctor. So that's dysuria. Males have pus formation in urethra, can cause sterility in men. Women have few symptoms, but can lead to what's called pelvic inflammatory disease, which that's bad. Can survive several hours on fomites, improper laundering, have fimbriae. That means they have little extensions off their cell wall. So, that's toxic shock syndrome. And some more. Okay, I just went through that with you. So gonorrhea, now, of course, that's pus formation. Like I said, the street name, I apologize for the small. In fact, that's syphilis, sorry. I apologize for the small writing there. But it's called the clap because the urethra can become blocked, and somebody has to actually take their penis and smash it together to force the pus out. So the person can void their bladder. So that's where it got its nickname, the clap. Syphilis, bad. Another bad infection. Treponema pallidum, it is a bacterial infection. It's a spirochete, which are the little ribbon-shaped organisms. I don't have a picture of it here, but syphilis goes in stages. And primary stage, this is actually pronounced a chancre, this little area there. In fact, I should probably just bold that right there. It's kind of a rubbery lesion, but it's pronounced chancre, believe it or not. The infection appears at the site 10 to 90 days following exposure. Wow, this is average 3 weeks. Most of the time, it's not noticeable to men or women. So that's it. That's a chancre, and it develops. This was on the course of male, but that actually goes away, and that's called the primary stage of syphilis. Secondary stage actually came from a hospital I was working in. These are lesions. That's the second stage of syphilis. Several weeks after the primary stage, Characterized mainly by skin rashes of varying appearance. The rash is distributed on skin and mucous membranes. Oh, okay. And the rash is okay. Mucous membranes are the rash is highly contagious. I'll try to change that. It doesn't make any sense. But yeah, if you touch those lesions, you can possibly get it. Same thing. Syphilis can stay in these stages. It can go away like that and come back as an outbreak. There is a stage that's sometimes called the latent stage, where everything disappears and it may come back at a later time. Latent just means delayed. There's no signs or symptoms, not contagious during this period. Mother can pass it to the fetus. Says usually doesn't progress beyond this point. If it goes to what's called the tertiary stage, which is neurosyphilis, that person's most likely not going to make it. They're going to die. These are called gumas. See these big lesions here, and that's something else. But they can show up, and formation of gumas, they're these kind of rubbery, say this should have been highlighted as well, these kind of rubbery lesions that show up, can develop into cardiovascular syphilis or neurosyphilis, and it's usually fatal. So those are all the stages: primary, secondary, and primary it actually goes away, secondary goes away, but then it comes back. And there's a latent time, but yeah, there's technically 4 stages. But as far as characteristics, like it says there, it's just let me do this. Okay, so now the pelvic inflammatory disease, that just sounds so painful. I know that inflammation hurts. Just think about, you get an inflamed joint or anything, usually causes pain, but that was a picture of some inflamed internal organs here. So pelvic inflammatory disease, necessary gonorrhea, you can get it all different ways, but as far as, it says lymphatic spread of venereal infection, spread of urinary tract infection, dysuria, abdominal pain, and burning hypogastric pain. It sounds very painful. Genital herpes, herpes simplex type 2, causes outbreaks or eruptions, which is like a rash, but the rash burns. Well, and that's showing it on males. That really isn't doing it justice, but it's an outbreak. It's called an eruption, but those are nerve endings that are like that. That looks like, you're looking at that going, that's warts. No, those are nerve endings that are irritated. But this is HSV type 2. And basically when a person gets this, it goes away, and then it comes back once a month. So, and it stays for a few days. And a person's only infectious when they're having an outbreak in lesions. So possibly fomites, congenital. Painful lesions, outbreak usually on the genital areas, red areas, and painful burning. Absolutely. All right, so I hope these help. That was a real short, just kind of tour of all of the reproductive and the UTI infections.